Everyone who is getting older knows this. Over time, medications often pile up. Sometimes, they are tablets for high blood pressure, others for pain or to regulate blood sugar. But what many seniors don't know, or underestimate, is the danger posed by combining multiple medications. This phenomenon, known as polypharmacy, is a silent threat that affects millions of older people in Germany every year. Why? Because our bodies react differently to medication as we age. The liver and kidneys no longer work as efficiently, which means that drugs remain in the body longer and can interact with each other. The result: unexpected side effects, increased risks, and in the worst case, life-threatening conditions. A study by the Federal Institute for Drugs and Medical Medicine showed that around 40% of people over the age of 65 take at least 5 different medications every day. Even more alarming, over 10% combine drugs whose interactions can have fatal consequences. Many seniors take these combinations unknowingly, often without informing their doctors or pharmacists about all the medications they are taking, including over-the-counter drugs. This is a widespread problem that quietly but effectively affects the health of many people. These first few lines are intended to shake you up and show you that you are not helpless, because knowledge of these dangers is your first weapon. The aim here is not to scare you, but to give you back control. The right information will help you recognize risks, talk to doctors, and make your life safer. In this video, we will present the 3 most dangerous drug combinations that seniors often take unknowingly, and which can have serious consequences. From blood thinners in combination with painkillers, to heart medications that can interact fatally with antibiotics. We explain what you need to know. So stay tuned and get ready to recognize these vital warning signs. Our health and our lives often depend on such seemingly small details. Have you or someone you know ever experienced unexpected side effects? Feel free to write about it in the comments. We read every message and respond personally, because your safety is important to us. Don't forget to subscribe to our channel Klarvital. Here we regularly share valuable tips to help seniors live healthy, independent, and safe lives. Together, we can bring the topic of medication safety to the forefront. The next chapter is dedicated to the first dangerous combination, blood thinners and painkillers, and explains why this mixture can be deadly. Stay tuned, it's worth it. Blood thinners and painkillers, a dangerous combination. Blood thinners, medically known as anticoagulants, are lifesavers for many seniors. They prevent dangerous blood clots from forming, which can cause heart attacks or strokes. But it is precisely these vital medications that, when combined with certain painkillers, can become a deadly cocktail. The combination of blood thinners such as warfarin or newer dopes, direct oral anticoagulants, with so-called NSAIDs, non-steroidal anti-inflammatory drugs, is particularly often underestimated. These include medications such as ibuprofen or diclofenac, which many people take for pain or inflammation. Why is this combination so dangerous? NSAIDs not only relieve pain, but can also irritate the stomach lining and cause minor bleeding. When combined with blood thinners, the risk of bleeding increases dramatically, especially in the gastrointestinal tract. This can lead to hidden internal bleeding, which is often detected only at a late stage. Symptoms such as blood in the stool, sudden weakness, or a pale complexion should be taken seriously immediately. A study by the Mayo Clinic showed that seniors who took this combination had a 2 to 3 times higher risk of severe bleeding. Unfortunately, many older people take painkillers without medical advice because they want to relieve pain without knowing the risks they are taking. Even over-the-counter painkillers are not harmless, especially when combined with other medications. What are the alternatives? If you suffer from chronic pain, you should definitely talk to your doctor and try alternative painkillers or therapies such as physiotherapy, heat treatment, or gentle exercise. Paracetamol is often a gentler alternative, but caution should be exercised with the dose. In addition, there are now targeted blood thinners that interact less with other medications, but careful medical supervision remains essential. It is particularly important that you inform your doctor and pharmacist about all medications you are taking, including herbal and over-the-counter remedies. This is the only way to minimize the risk of dangerous interaction. Have you ever noticed side effects when taking painkillers together with blood thinners. Share your experiences in the comments. This can help other seniors to be more cautious. Stay informed and alert, because only with knowledge can you protect yourself from avoidable danger. Subscribe to our Clara Vital channel so you don't miss any important tips. In the next chapter, we will focus on the second risky combination, benzodiazepines and opioids, and how these two drugs can endanger your breathing. Stay tuned for more life-saving knowledge. Benzodiazepines and opioids, a dangerous combination for your breathing. Many seniors suffer from sleep problems, anxiety, or chronic pain. To alleviate these symptoms, doctors often prescribe benzodiazepines, such as diazepam or lorazepam, as well as opioids, such as tramadol or morphine. However, these two groups of drugs together can seriously endanger your health, especially your breathing. The interaction can lead to life-threatening respiratory depression, which often goes unnoticed until it is too late. Benzodiazepines have a calming effect on the central nervous system. They help reduce anxiety and improve sleep. Opioids, on the other hand, are strong painkillers that dull the sensation of pain. However, both drugs also slow down breathing. When taken together, this effect can be magnified, causing breathing to become dangerously shallow or even stop altogether. A study from the US showed that almost 20% of seniors who took both drugs at the same time had a significantly increased risk of respiratory arrest. This is particularly dangerous for people with existing respiratory diseases, such as COPD or sleep apnea. However, those affected are often unaware of the danger because the symptoms are initially nonspecific: fatigue, poor concentration, or frequent daytime sleepiness. How can you protect yourself? It is important never to take benzodiazepines and opioids at the same time without close medical supervision. Always inform your doctor about all medications you are using, even if they are only occasional or over-the-counter. Ask about alternatives, such as non-drug methods for anxiety or pain relief, such as relaxation exercises, physical therapy, or acupuncture. If you need to take both medications, watch for warning signs, such as shortness of breath, extreme drowsiness, or confusion, and seek medical help immediately. Have your medication checked regularly by your doctor and ask whether all medications are still necessary. Do not hesitate to seek support from family or caregivers. They can often help monitor medication and watch for possible side effects. Have you had experience with this combination of medications, or do you know someone who has? Share your story in the comments. This will help us to understand each other better and be more cautious. Don't forget to subscribe to our Clara Vital channel to learn more about safe medication use and other important health topics for seniors. In the next chapter, you will learn why certain heart medications, combined with antibiotics, can cause your heart to falter and how you can prevent this. Heart medications and antibiotics, the silent dangers to your heart. For many seniors, heart medications are an indispensable part of everyday life. They help regulate blood pressure, stabilize heart rhythm, or improve heart performance. At the same time, we sometimes need antibiotics when infections occur. However, combining certain heart medications with certain antibiotics carries a risk that is often underestimated: prolonging the so-called QT interval in the heart. This change can cause life-threatening cardiac arrhythmia. The QT interval describes the time the heart needs to recover electrically between two beats. If this interval is prolonged, the heart can lose its rhythm and so-called torsades de pointe can occur, a dangerous form of tachycardia that can lead to sudden cardiac arrest. Certain antibiotics, such as macrolides like clarithromycin or azithromycin, are known to prolong the QT interval. Heart medications, such as antiarrhythmics or some diuretics, can also increase this effect. When these drugs are combined, the risk increases dramatically. Seniors with pre-existing heart disease, electrolyte imbalances, or a genetic predisposition are particularly at risk. Unfortunately, many patients and even some doctors are not always aware of this danger, as the symptoms are often non-specific. Dizziness, palpitations, fainting, or sudden weakness can be signs of a dangerous arrhythmia. A study by the University of Heidelberg showed that seniors who combined heart medications with certain antibiotics had up to 5 times the risk of severe cardiac arrhythmias. Early detection and adjustment of medications can save lives. What can you do to protect yourself? First, it is important to always inform your doctor or pharmacist about all medications you are taking. Ask about possible interactions, especially if you are prescribed an antibiotic. If there is a risk, there are often alternative antibiotics that are. If you are taking heart medication, have your heart function and electrolyte levels checked regularly. Seek medical attention immediately if you experience new symptoms such as palpitations, fainting, or dizziness. Have you ever experienced antibiotics affecting your heart medication? Please share your experience in the comments to warn and educate others. Subscribe to Claire Vital to receive more vital tips that will protect you from such risks. In the next chapter, we will discuss why seniors are particularly susceptible to dangerous drug interactions and how you can avoid them. Why seniors are particularly susceptible to dangerous drug interactions. As we age, our bodies change, not only in terms of our outward appearance, but also in how our bodies process medication. These changes make seniors particularly susceptible to adverse drug reactions and dangerous combinations. Understanding why this is the case is crucial to avoiding risks and protecting your health. First, liver and kidney function slows down with age. These organs play a key role in breaking down and excreting medications. When they no longer work as efficiently, active ingredients remain in the body longer and can accumulate, leading to increased stress and stronger side effects. This explains why even standard dosages can often be too much for seniors. Secondly, the body's receptors and sensitivity to medication change. As a result, some active ingredients may have a stronger or weaker effect than in younger people. This change increases the likelihood of medications interacting with each other or amplifying undesirable effects. Thirdly, seniors often take a large number of medications. The phenomenon known as polypharmacy means that many older people take 5 or more medications at the same time. The more medications there are, the greater the risk of interactions, even if individual medications are safe on their own. An example, Mr. Miller, 78 years old, was taking several prescribed medications for high blood pressure, diabetes, and sleep disorders. He also used over-the-counter painkillers. Without knowing it, the combination of these drugs caused him to have circulatory problems and increased fatigue, which ultimately led to a fall. Unfortunately, such situations are not uncommon. The good news is that these risks can be significantly reduced. An important step is to regularly create a medication plan and present it at every doctor's appointment. This allows all treating physicians to maintain an overview and avoid dangerous combinations. It is equally important that you obtain your medications from a pharmacy that is familiar with all of your medications and can check for interactions. In addition, you should never take new medications or discontinue existing ones on your own without first consulting a doctor. Herbal preparations and dietary supplements can also cause interactions and should always be disclosed. Actively inform yourself about your medications, ask about side effects, and have the package insert explained to you if anything is unclear. Family members and caregivers can also play an important role by watching for changes and supporting you in your daily life. Have you ever experienced a combination of medications causing problems for you or a family member? Share your experiences in the comments. Together, we can learn from each other. Subscribe to Claire Vital to receive valuable tips on medication safety and healthy living. In the next chapter, you will learn how to recognize dangerous medication combinations early on and protect yourself from them. Stay tuned. How to recognize and avoid dangerous drug combinations early on. Recognizing dangerous drug combinations is a major challenge for many seniors. Often patients do not even know which medications they are taking on a daily basis, or what side effects may result from interactions. But with a few simple steps and a little mindfulness, you can protect yourself and your health. First, you should always keep a complete list of all the medications you are taking. This includes not only prescription drugs, but also over-the-counter medications, dietary supplements, and herbal preparation. This list will help your doctor and pharmacist identify and avoid interactions early on. Second, take advantage of modern technology. There are now numerous apps and online databases where you can enter the ingredients of your medications to check for potential risks. These tools are not a substitute for visiting your doctor, but they are a valuable addition. Third, be open in your conversations with your doctors and pharmacists. Tell them about all the medications you are taking, even if you think they are harmless. Ask specifically about interactions and possible alternatives. Risky combinations can often be avoided or replaced with safer preparation. Sudden fatigue, dizziness, unusual bleeding, palpitations, or shortness of breath can be signs of a dangerous drug interaction. If you notice such symptoms, seek medical help immediately. Fifth, arrange regular medication reviews, ideally at least once a year. Your doctor will review your entire medication regimen with you, adjust dosages, and remove any medications that are no longer needed. This reduces the risk of interactions and over-medication. Sixth, avoid taking multiple medications at the same time on your own. Even if you only need a medication occasionally, it can be dangerous when combined with others. Always follow your doctor's instructions. You are not alone. Many seniors face similar challenges. That is why it is important to talk to each other and share experience. Write to us in the comments section and tell us what measures you have taken to increase your medication safety. Don't forget to subscribe to our Claire Vital channel so that you can stay up to date with the best tips for your health. In the next chapter, we explain how relatives and caregivers can play an important role in protecting seniors from dangerous medication combinations. Stay tuned. The important role of relatives and caregivers in medication safety. As you get older, it's not always easy to keep track of all the medications you need to take. This is where relatives and caregivers come in. They can play a crucial role in preventing dangerous drug combinations and protecting your health. This is because they are often more likely to notice small changes or warning signs than you are. One of the most important tasks for family members is to keep an accurate record of all the medications you are taking. This list should be updated regularly and presented at doctor's appointments. This allows doctors to better assess and avoid interaction. Caregivers can also ensure that you take your medications correctly and on time, which reduces the risk of errors. But their role goes far beyond that. Family members and caregivers should also pay close attention to changes in behavior or health. Symptoms such as confusion, dizziness, sudden fatigue, or unexplained complaints can be indications of undesirable effects or interactions. In such cases, it is important to consult a doctor quickly. Another important point is communication. Relatives can act as a link between you and various doctors or pharmacists. They help to consolidate information and avoid misunderstandings, especially when several specialists prescribe different medications. This coordination is crucial to avoid dangerous combinations. In addition, caregivers can support you by storing medications safely, checking the correct dosage, and if necessary, monitoring their intake. This support is often vital, especially in the case of complex treatment plans. An example, Ms. Schmidt, 82 years old, lives alone and takes 7 different medications every day. Her daughter supports her by keeping a medication schedule and talking to the doctors every month. When Ms. Schmidt suddenly began to suffer from increased dizziness, her daughter was able to react quickly and uncover a dangerous interaction error, which was corrected immediately. These examples show how valuable the interaction between seniors, relatives, and nursing staff is. If you are a relative yourself, don't be afraid to ask questions, get informed, and actively participate. And if you are older yourself, accept the help of your family or caregivers. It is a sign of strength to let yourself be protected. Do you have experience with support from family members when taking medication? Share your story in the comments and help others who may be experiencing similar situations. Subscribe to Claire Vital to receive more practical tips for a safe and healthy life in old age. In the next chapter, you will learn which questions you should definitely ask your doctor before taking a new medication. Stay tuned. Important questions to ask your doctor before taking a new medication. Every new medication visit brings opportunities, but also risks, especially for seniors who often take several medications at the same time. To ensure that new medications do not cause dangerous interactions or unnecessary side effects, it is essential to be well prepared for your doctor's appointment. Here you can find out which questions you should definitely ask in order to protect your health as best as possible. First, you should ask about possible side effects. Many patients think that medications only help, but every drug can also have undesirable effects. Ask specifically what side effects may occur and how common they are. It is particularly important to know which signs need to be taken seriously and when you should seek immediate medical attention. You should also ask about possible interaction. Give your doctor a complete list of all the medications you are currently taking, including over-the-counter medications and herbal supplements. Ask specifically whether the new medication could interact with any of your other medications. There are often alternatives or adjustments that can reduce the risk. Another important question concerns the duration of use. Sometimes medications are prescribed for unnecessarily long periods of time, or the dose is too high. Clarify how long the medication should be taken, and whether there are options for reducing or stopping treatment later. The timing of administration is also crucial. Ask whether the medication must be taken with meals or whether it is more effective in the morning or evening. This can minimize side effects and increase effectiveness. Ask about how to store the medication. Some medicines must be kept cool or in the dark, while others are sensitive to heat. Incorrect storage can impair the effect or promote side effects. It is also a good idea to ask whether certain foods, drinks, or activities should be avoided while taking the medication. Alcohol, grapefruit juice, or certain herbs can cause interactions. If you have concerns about the cost, discuss this openly. Sometimes there are cheaper generic drugs or alternative treatment options. An example: Mr. Bauer wanted a new blood pressure medication. By asking specific questions, he learned that it could interact with his sleeping pill. Together with his doctor, they chose a safe alternative and adjusted the times at which he took his medication. Use your doctor's appointments to stay informed and actively participate in decisions. This protects you from surprises and helps you find the best treatment for you. How do you prepare for doctor's appointments? Do you have any tips or experiences you would like to share? Write to us in the comments. You'll be helping the whole community. Subscribe to Claire Vital so you don't miss any important health tips. In the next chapter, we'll show you how to organize and take your medications correctly to avoid dangerous mistakes. Stay tuned. How to organize and take your medications correctly to avoid dangerous mistakes. For seniors taking multiple medications, proper organization and intake are the keys to greater safety and well-being. Even small mistakes, such as forgetting a dose or combining the wrong medications, can have serious consequences, from deteriorating health to dangerous interactions. That's why it's so important to find a simple, reliable method of medication management. Start with a clear overview. Keep a detailed medication plan that includes all your medications, dosages, times of administration, and the purpose. Also note who prescribed the medication and whether there are any special instructions. This will help you and your doctors keep track, especially if you visit different specialists. Medication boxes can help you better structure your medication time. There are models with multiple compartments for each day of the week and each time of day: morning, noon, evening, and before bedtime. This helps you ensure that you don't forget a dose or take a double dose. Some boxes even have electronic reminders or alarms. Be sure to take your medication at the same time every day to establish a routine and optimize its effectiveness. Avoid taking tablets with unsuitable drinks, such as grapefruit juice, which can increase the effect of some medications. Water is usually the best choice. Ask family members or caregivers for help if you have difficulty organizing your medications. Sometimes a visit to the pharmacist can also help. Many pharmacies offer medication checks and can pre-sort your medications. Store your medications safely, but still easily accessible. Store them in a dry place, protected from light, and out of the reach of children. Dispose of expired or no longer needed medications properly, so that you do not cause confusion. Avoid changing or discontinuing medications on your own. Any changes should be discussed with your doctor. Even if you feel better, it is important to complete the course of treatment as prescribed, especially with antibiotics or certain heart medications. When you receive new medications, read the package insert carefully and ask your doctor or pharmacist if you have any questions. Make a note of any side effects or changes you notice, and inform your healthcare providers
Well-organized medication management gives you peace of mind and helps prevent unwanted effects. It protects you from dangerous mistakes and supports your independence. Have you found any tips or tools that help you take your medication? Share your experiences in the comments and help others use their medications more safely. Subscribe to Claire Vital for more practical advice on your health and old age. In the last chapter, we summarize the most important findings and give you clear instructions for the safe use of medication. Stay tuned. Summary and clear instructions for the safe use of medication in old age. The safe use of medication is vital for seniors. In the last few chapters, we have learned that as we age, our bodies process medications differently, and that dangerous interactions often go unnoticed. Heart medications, antibiotics, painkillers, and many other drugs can pose unexpected risks when taken together, from cardiac arrhythmia to kidney strain to severe allergic reactions. It is important that you as a patient take an active role. A complete overview of all medications, including herbal remedies and dietary supplements, is essential. Keep an up-to-date medication plan and share it with your doctor at every visit. Enlist the support of family members and pharmacists to identify and avoid potential risks. Regular checkups and medication reviews help to discontinue unnecessary medications and adjust dosages. Ask your doctor specifically about side effects, interactions, and alternative treatment options with each prescription. Pay close attention to warning signs such as dizziness, palpitations, fatigue, or new symptoms, and seek help early if necessary. Structured intake with the help of medication boxes, reminders, and clear routines minimizes errors and ensures greater safety. Store medications properly and dispose of expired or no longer needed medications in the appropriate manner. Remember, medications are an important tool for maintaining your health, but they must be used with respect and knowledge. Be informed, be careful, and use all available resources. This will protect you from avoidable risks and help you stay healthy and independent for longer. We hope this series has helped you better understand this complex topic and feel more confident about using your medication. Share this important information with your friends and family. Often loved ones also know too little about these risks. Do you have any questions, requests, or experiences of your own? Write them in the comments. We read all messages and look forward to the exchange in our Claire Vital community. Subscribe to our channel so you don't miss any important health tips. Your health is your most valuable asset. Protect it with knowledge and attention. See you in the next video. Stay healthy and be careful.